All right, so we've got quite a bit of research here on underactive bladder in men,
Yeah.
UAD, and looks like you've zeroed in on these latest guidelines from the European Association of
All
Urology,
right, definitely.
a summary paper
It's
from
a
European Urology,
it's a big deal.
just out this year.
Yeah, it just came out in 2024. It's pretty cutting edge stuff.
Okay, so we are going to try to break this down for everybody listening, make it understandable, take the complex medical jargon and try to simplify it,
Mm.
and really dig into, how is UAB diagnosed and what are the treatment options. So hopefully by the end of this deep dive, our listeners will feel a lot more comfortable uh, talking with their doctor about this or talking with loved ones.
Yeah, and I think, one of the big things that we're going to see here is that this is a condition that really flies under the radar. It's not something that people talk about very openly, but it can have a huge impact on men's quality of life.
Yeah, for sure. So let's just jump right in. What is underactive bladder? We hear weak bladder and all that. What are we actually talking about in clinical terms?
Well, the paper makes a really important distinction between UAB, which is sort of the symptoms and clinical features, and then detrusor underactivity, or DU, which is a urodynamic diagnosis.
So you really have to, clearly communicate with your doctor about your symptoms
Absolutely.
to get to a proper diagnosis.
Yeah, and just imagine the frustration of never feeling like you fully empty your bladder. You constantly have to go to the bathroom, but then nothing comes out or very little. That's the reality for a lot of men that have DU.
Okay.
And basically what it comes down to is a contraction of the bladder muscle that's either reduced in strength or duration. And this leads to prolonged bladder emptying and sometimes the inability to empty completely.
So it's not just about frequency, but it's also about this sensation of incomplete emptying,
Exactly.
which I imagine is really frustrating.
Yeah.
And we tend to think of this as an old man's problem, right?
Yeah, that's a common misconception. While the exact prevalence of DU in the general population isn't really known,
Okay.
studies show it affects something like 10% to 48% of men referred for urodynamic testing.
Wow.
And that's particularly in men over 70, but it can certainly affect younger men as well.
Okay.
Interestingly, it seems like DU follows a plateau-like course. So it's chronic, but it doesn't necessarily get dramatically worse over time.
Okay, so it's not a sudden decline,
Right.
but it's more of just like this, persistent
Exactly.
issue.
Yeah.
So what causes this weak bladder then? Is it always just age-related?
Not at all. The paper breaks down the cause into three main categories: neurogenic, myogenic, and iatrogenic.
Okay, break those down for me.
So neurogenic means it's coming from the nervous system.
Okay.
So this could be due to conditions like multiple sclerosis or Parkinson's disease,
Uh-huh.
both of which can affect the nerves that control the bladder.
Okay, so the signals aren't getting there, right?
Exactly.
What about myogenic?
Myogenic means there's a problem with the bladder muscle itself or the tissues around it. Okay.
So this could be bladder outlet obstruction, BUO, where there's something physically blocking the flow of urine, or it could be something like diabetic bladder dysfunction, where high blood sugar levels can damage the nerves and muscles of the bladder.
So there's lots of ways that that muscle itself can be compromised.
Exactly.
Iatrogenic, what is that?
That basically just means it's caused by a medical intervention.
Oh, okay.
So this could be side effects of pelvic surgery, or it could even be certain medications like anticholinergics, which are used to treat overactive bladder,
Interesting.
or opioids, which are strong painkillers.
Wow. So the treatment for one thing can actually lead to
Yeah,
underactive bladder. That's something to consider.
And then, of course, there's also the category of idiopathic, which essentially means we don't know the exact cause.
Yeah, a little bit of mystery.
Yeah.
So if there's no one telltale symptom, how do doctors actually figure out if someone has UAB? How do they go about diagnosing it?
Well, it starts with, a thorough medical history and physical exam.
And this helps identify any potential underlying causes and just get a good overall picture of the symptoms you're experiencing.
But you're saying that the presentation can vary so widely.
It really can.
Yeah.
Some men might be completely asymptomatic, while others might experience chronic urinary retention, where they can't empty their bladder at all.
Wow.
And then there's a whole spectrum in between.
So how do you move from those general symptoms to an actual diagnosis?
Right.
What are the tools that are used?
So questionnaires can be helpful for assessing general lower urinary tract symptoms, or LUTS,
Okay.
but they're not really designed to diagnose UAB specifically.
So there's a starting point, but not the whole picture.
Exactly. Uroflowmetry, which measures urine flow rate, can help distinguish UAB from buro, but the accuracy of that is still kind of debated in the literature.
Okay.
Ultrasound is showing promise as a non-invasive way to assess bladder function, particularly measuring the detrusor wall thickness and bladder capacity.
So we keep hearing about this outflow resistance. Yeah. Is that unique to UAB, or is that something that plays a role in other bladder conditions as well?
It definitely plays a role in other bladder conditions.
Okay.
So in UAB, the weak bladder muscle may struggle to overcome any resistance, which makes it hard to empty completely.
Yeah.
But then in other conditions, like BPH, you have an enlarged prostate that's actually causing the resistance.
Right, yeah.
So the underlying cause is different, but the end result can be similar. Difficulty voiding.
So it's really important to tease apart what that specific resistance is.
Yeah, I think
to know how to best treat it. What else is used for diagnosis?
Another key measure is post-void residual, or PVR, which basically tells you how much urine is left in the bladder after you pee.
Oh.
A high PVR can be a sign of DU, but there's no magic number that definitively diagnoses the condition.
So if all of these are sort of inconclusive, how do you get to a definitive diagnosis?
That's where invasive urodynamics comes in.
Okay.
Which is really the only widely accepted method to diagnose DU for sure.
Okay, so this is very in-depth.
It is.
What happens during that?
So basically, they're measuring the pressure inside your bladder as it fills and empties.
Okay.
And that gives us a clear picture of how well your bladder is functioning and how strong your bladder muscle contractions are.
So getting to the root of the problem.
Yeah.
Let's say you go through all of this, you get a DU diagnosis. What next? What are the treatment options that are out there?
Well, the good news is there are a lot of ways to manage UAB and improve quality of life.
Okay.
And treatment typically starts with what we call conservative management, which focuses on lifestyle changes and non-invasive techniques.
All right, sounds like a good place to start. So what does that look like? What does conservative management entail?
So this could include things like behavioral interventions, such as timed voiding, double voiding, or using techniques like the Valsalva or Creed maneuver to help empty the bladder more effectively.
Could you explain those maneuvers a little bit more?
Sure. So I know this might sound a little weird, but imagine you're, well, let's just say you're really straining on the toilet. That's essentially the Valsalva maneuver. The Creed maneuver involves applying gentle pressure to the lower abdomen to help empty the bladder.
So these are about, sort of regaining that sense of control that's often lost.
Exactly.
With this condition.
Yeah.
It's about empowering you to actively manage it.
Exactly. And one thing that struck me when I was reviewing these guidelines is that there aren't really any clinical trials looking specifically at these kinds of behavioral therapies for non-neurogenic UAB in men.
Wow.
So that's a big area where more research is needed.
Yeah, for sure. What else is there as far as conservative approaches go?
Another common approach is pelvic floor muscle relaxation training,
Okay.
which involves learning to relax the muscles that control urination.
Okay.
This is often a first-line therapy, although, again, the evidence for its effectiveness in men with UAB is limited.
So more research needed there as well.
Absolutely. Now let's move on to another really important aspect of conservative management, which is clean intermittent catheterization, or CIC. This is the preferred method for draining the bladder if your PVR is persistently high, especially above 300 milliliters.
So that's when you're not emptying effectively on your own.
Right.
Yep.
So CIC involves inserting a thin, flexible tube into the bladder through the urethra to drain the urine.
Okay.
And this is generally considered safe and effective, and it helps prevent complications like UTIs and kidney damage.
So a very proactive way to manage this.
Exactly.
And prevent further issues. But I imagine it can be a big adjustment for some men.
It definitely can be.
Right.
But you're not alone. There are support groups out there that can help you navigate this.
Yeah, and I think that's really important to remember. That sense of community and support can make a world of difference. What other things are there within that conservative management category?
The guidelines also mention a couple of less established options like intravesical electrical stimulation and extracorporeal shockwave therapy.
Interesting.
But again, the research on their effectiveness for UAB is still pretty limited.
So those are more experimental at this point. What if these conservative approaches aren't enough? What other options are there?
Well, sometimes medications can help manage the symptoms,
Okay.
but other times men might require more intensive intervention. And that's where surgical options come in.
Okay, let's explore those in more detail.
So one option is benign prostatic surgery, but it's important to emphasize that this is only for men who have both DU and BPO, meaning they have an enlarged prostate that's contributing to their symptoms.
So not a universal solution for UAB?
Not at all. And even for men who do undergo this surgery, the outcomes are often less favorable compared to men without DU.
Okay, that makes sense. Are there other surgical options for men who have DU but don't have BPO?
There is. Another option is sacral neuromodulation, or S&M. This involves implanting a device that sends electrical impulses to the nerves that control the bladder.
Okay.
It's been shown to be effective for other bladder conditions, but the evidence for its use in men with UAB is still limited. So this is another area where more research is needed to really understand the potential benefits and risks.
Yeah, sounds like a lot more to discover about that as a potential treatment for UAB.
Definitely. But, in addition to surgery, there are also medications that can be helpful in managing UAB.
Okay, let's dive into the world of medications then. What kinds of drugs are we talking about here?
One class of medications is called parasympathomimetics. However, the guidelines don't recommend them routinely. Studies show that they only offer a small benefit for some patients, and they don't actually improve PVR.
So not a magic bullet then. Are there other options?
Another class of drugs that shows some promise is alpha-adrenergic blockers.
Okay.
These medications help relax the muscles in the prostate and bladder neck, which makes it easier to pee.
Interesting. What other medications are used?
Finally, there's a class of medications called prostaglandins, which may help reduce postoperative urinary retention, but their role in treating established UAB is still uncertain.
So more research needed there.
Yeah, for sure.
Well, this has been a really informative deep dive so far. We've covered a lot of ground, from understanding the condition and its causes to exploring the diagnostic process and the range of treatment options available.
And we've seen that UAB in men is a complex condition with a lot of different causes, and there's no one-size-fits-all approach to treatment.
But even with all that complexity, there's hope for effective management and improved quality of life.
Absolutely. And we'll continue our exploration in part 2 of this deep dive, where we'll delve further into the nuances of UAB and what the future holds for research and treatment.
Stay tuned. We'll be right back. We're back and ready to continue this deep dive into underactive bladder in men. Getting into the nitty-gritty of these guidelines has been really enlightening.
Yeah, it's really interesting to see how this field is evolving and, honestly, how much we still don't know.
That's what makes it so important to stay informed, right?
Absolutely.
Knowledge is power.
For sure.
Especially when it comes to our health.
Absolutely. And that brings us to a really important point, which is the importance of follow-up care for men with UAB.
Right, because it's not just like a one-and-done kind of deal, is it?
Not at all. The guidelines emphasize that long-term data on UAB is really scarce.
Okay.
Which makes predicting the course of the condition really challenging. We just don't have enough information yet to say with certainty, how UAB will progress over time for each individual.
Yeah, that really highlights the need for more long-term studies.
Definitely.
Looking at treatment outcomes.
Yeah.
For UAB, because it's sort of like we're navigating uncharted territory.
Exactly, and that's why follow-up is so crucial. Even if you're feeling better after treatment, it's important to stay in touch with your doctor.
So those regular checkups are about making sure that the treatment plan is still effective and catching any potential complications early on.
Exactly. Now, one question that comes up a lot is whether or not the bladder can actually recover its ability to contract properly.
Okay, so is there like a chance that the bladder can regain its strength over time?
That's a great question, and the answer is it's possible, but we need more research. The guidelines mention that some men do experience a recovery of detrusor contraction after treatment.
Okay.
But the research is very limited and inconclusive at this point.
So it's not something you can necessarily count on, but it's also not impossible.
Right.
Seems like there's still a lot of unknowns when it comes to that long-term trajectory of UAB.
Absolutely. And this is another area where more research is desperately needed. We need to understand what factors influence the likelihood of recovery and how we can optimize treatment to promote it. Imagine if we could identify those individuals who are most likely to experience recovery and then tailor their treatment plans accordingly.
That would be amazing.
It would be a game changer.
So what does all of this mean for men who are living with UAB? And what can they do to advocate for their own health?
That's a great question. First and foremost, I think it's crucial for men to just be aware of UAB as a potential cause of their symptoms. Too often, men suffer in silence, unaware that their symptoms have a name and that effective treatments exist.
Right, because if you don't even know it's a possibility, you might not even bring it up with your doctor.
Exactly. And that's where knowledge and self-advocacy come in. If you're experiencing any voiding difficulties, don't hesitate to talk to your doctor and specifically ask about UAB. Be your own health advocate.
And don't be afraid to ask for a referral to a urologist.
Absolutely.
If you feel like your concerns aren't being addressed. It's so important to find the right healthcare professional.
Absolutely. Urologists specialize in the urinary tract, and they have the expertise to diagnose and manage UAB effectively. They can help you navigate the diagnostic process, understand your treatment options, and ultimately find the best approach for your individual needs.
So knowledge, self-advocacy, finding the right healthcare professional. Those are definitely key takeaways. But what about the emotional and social aspects of living with UAB? It's not just about the physical symptoms.
That's an incredibly important point. It's not just about the physical symptoms, it's about the impact that those symptoms have on a man's overall well being, his relationships, his self esteem.
Hmm.
UAB can be isolating and it can affect a man's sense of masculinity. It's crucial to remember that UAB is a medical condition, it's not a personal failing.
Yeah, it's so important to kind of address that stigma surrounding bladder issues
Definitely.
and encourage open conversations about these challenges.
Absolutely. We need to normalize these conversations so that men feel comfortable seeking help and support.
Talking about your health is a sign of strength, not weakness.
Exactly. And remember, there are resources available to help you cope with the emotional and social aspects of UAB support groups, therapists, online forums. These can all provide a safe space to share your experiences and connect with others who are going through similar challenges.
That sense of community is so powerful.
It is.
Just knowing that you're not alone in this journey. And while seeking professional help is important, are there things that men can do on their own to manage UAB? Are there lifestyle changes that can make a difference?
Absolutely. While lifestyle changes alone may not cure UAB, they can certainly contribute to overall well being and they may help alleviate some of the symptoms. Staying hydrated is crucial, as is maintaining a healthy weight.
What about diet? Are there specific foods or drinks that men with UAB should avoid?
Avoiding bladder irritants like caffeine and alcohol can be helpful.
Okay.
It's also a good idea to be mindful of foods that might trigger your symptoms, as everyone reacts differently to certain foods. Keeping a food diary can help you identify any potential triggers and make adjustments to your diet accordingly.
So it's about paying attention to your body's signals and figuring out what works best for you.
Exactly.
And even though there's still a lot we don't know about UAB, there's hope for effective management and improved quality of life, even if it is a chronic condition.
Definitely. And I think it's important to stay hopeful and engaged in your healthcare journey. Ask questions, do your research, and work collaboratively with your doctor to find the best approach for you.
This has been a really insightful deep dive. We've covered a lot of ground, but it feels like we've only just scratched the surface of this complex topic.
I agree. And that brings us to the future of UAB research and treatment.
Okay.
There's so much potential for advancement in this field, and I'm really excited to see what the future holds.
Given the gaps in our knowledge that we've highlighted, what are some areas that you think are ripe for further exploration? What are the big questions that need answers?
That's a great question. One area that desperately needs more research is the development of non-invasive diagnostic tools.
Right, because as we were saying, invasive urodynamics is currently the gold standard, and it's not exactly a walk in the park.
Right.
Finding a more patient-friendly way to definitively diagnose DU would be a huge step forward.
It would, and imagine the possibilities if we could diagnose UAB earlier, before significant complications arise. We could potentially intervene sooner and prevent long-term damage.
Early diagnosis is key for so many medical conditions. What other areas of research do you see as particularly important?
I think we need more research on the long-term effectiveness of different treatment approaches.
Hmm.
We need to know what works best for different types of UAB and what the long-term outcomes are for men who undergo various treatments.
So it's not just about finding treatments that work, but understanding how they work over time and for whom they work best.
Exactly. It's about moving towards more personalized medicine where treatments are tailored to individual needs and characteristics.
And that includes exploring the potential for bladder function recovery,
Definitely.
which is still a bit of a mystery.
Absolutely. And finally, I think we need more research on the psychosocial impact of UAB. This is a condition that can really affect a man's quality of life, his relationships, his self-esteem. We need to develop more holistic and patient-centered approaches to care that address not just the physical symptoms, but the emotional and social challenges as well.
It's about treating the whole person,
Exactly.
not just a condition.
Precisely.
This deep dive has given us a lot to think about. We've covered so much, but it really feels like we've only just begun to explore this topic.
I agree, and that brings us to our final part of this deep dive, where we'll tie everything together and consider what the future holds for UAB. Stay with us.
All right, so here we are at the final part of our deep dive into underactive bladder in men. And Wow, we've covered a lot, haven't we? From those, first signs that something's off to the ins and outs of getting a diagnosis and then exploring all the different treatment options. UAB really is like a kind of a complex condition.
It really is. And, I think it's helpful to just take a moment to recap the key takeaways here. What have we learned on this journey?
Yeah, let's do that. Let's kind of tie everything together. So where should we start?
Well, first and foremost, we learned that UAB is, it's a symptom complex that suggests underlying detrusor underactivity, or DU. And it's really important to remember that DU itself is a specific urodynamic diagnosis. So it requires those specialized tests that we talked about to actually confirm its presence.
So just having symptoms isn't enough.
Yeah,
You really need to look at the bigger picture.
exactly.
How's the bladder functioning?
Exactly. And speaking of diagnosis, we learned that invasive urodynamics is currently the gold standard. But, thankfully, research is ongoing to try to develop more reliable, non-invasive methods. And that's an area that holds a lot of promise for the future.
Yeah, I mean, imagine being able to get a clear picture of bladder function without having to go through invasive procedures.
Exactly.
It would be huge.
It would be a game changer. And then, of course, we talked about all the different causes of DU, everything from neurological conditions to muscle and tissue problems to side effects of medications or surgery. It's amazing how many different things can affect bladder function.
It really is. And that just goes to show how important it is to, have that open communication with your doctor during that initial, medical history and physical exam,
Absolutely.
because all of those details could be relevant.
The more information your doctor has, the better. And then, of course, when it comes to treatment, we saw that the options are just as varied as the causes, ranging from, those conservative management techniques like timed voiding and pelvic floor muscle relaxation to medications and even surgical interventions in some cases.
Yeah, there's definitely no one-size-fits-all approach.
Not at all.
It's really about finding what works best for each individual.
Absolutely. It's about open communication, shared decision-making, and finding that personalized approach. And, while UAB is a chronic condition, it's important to remember that there are effective ways to manage the symptoms and improve your quality of life.
Yeah, absolutely.
Right.
There's no need to suffer in silence. There's help out there.
Yeah.
So as we wrap up this deep dive, I want to leave our listeners with a thought-provoking question, something to kind of ponder as they continue to learn about this topic.
Great idea.
So what is it? What's the question?
Well, we've talked about how limited the research is, especially on non-neurogenic UAB in men. So my question to you and to the listeners is, what kind of studies would you like to see done to improve diagnosis and treatment in the future?
That's a great question. It really makes you think about what are those gaps in our knowledge
Exactly.
and how can we push for progress?
What questions are still unanswered?
It's about being informed, being curious, and not being afraid to ask those tough questions.
Exactly. Maybe you'll be the one to spark the next big breakthrough in UAB research.
Oh, I love that. That's inspiring because it reminds us that we all have a role to play
We do.
in, advancing scientific understanding and improving healthcare for everybody.
Absolutely. It's a collective effort for sure. And as we conclude this deep dive, just remember that knowledge is empowering. It allows us to take control of our health and advocate for ourselves and for our loved ones.
Couldn't have said it better myself.
Yeah.
So thank you for joining us on this journey of knowledge and discovery. And we hope you feel equipped to, continue exploring the world of UAB in men.
It's been my pleasure. Until next time, keep those brains buzzing.